Hello everyone, I'm here with Arcita. Arcita, thank you so much for taking time out of your day to be here with us.
No problem.
I want to start off by asking you what your experience is with nurses.
Yeah, well, the main experience I've had is actually working closely with nurses in a professional setting. I work in the mental health field, and in that we have a multidisciplinary team, so we actually work closely with the nurses within that. But I've also had experience, of course, in the hospital setting, as well as outpatient clinics and those kind of locations.
Okay, so when you say you've had experience in hospital settings and everything like that, does that mean that you were a patient?
Yes, I was a patient, yeah.
Okay, great. Okay, now the first question, if I were to say what you think of when you hear the word nurse, what would you say?
Well, I often think of someone wearing white, of course, but also someone who is calm and collected, very kind, but also the image of a woman comes to mind.
I'm actually glad you brought that up because that's kind of the whole topic of this discussion.
Okay.
So the first thing I'm going to ask you is whether you were a patient or working in the field, what was the majority of the nurses as far as gender?
Yeah, well, professionally, the majority of the nurses I've worked with were women. I can't actually think of a male nurse that I have worked with, but as a patient, I've also seen a lot of female nurses. There's a couple of males, yeah, but the majority was most certainly female.
Okay. Now, as a patient, how did you feel about your nurses being male or female? Like, what gender were you more comfortable with, and vice versa?
Yeah, that's a good question. I think the sensitivity of why I'm going to seek out medical attention is important in what gender I see. If it's a sensitive matter like going to a gynecologist, I would most certainly prefer a female. But otherwise, I don't think that I would have a preference. Given that the majority of the ones I've seen have been female, I think there's just a comfort level in the familiarity, but otherwise, I don't think so.
Yeah, definitely. Good. Now, this is kind of a controversial question, but we do appreciate your honesty in this. If I were to ask what gender do you feel is more competent, which one would you say and why?
Well, I don't think that gender makes a difference in competence. I think that's a whole different social issue, but concerning this question, no, I definitely don't think that one gender makes a difference. I've seen mostly females and they have been extremely competent, but otherwise, no.
Very good. Now, I know that when we think of women versus men, we tend to think that women are much better at giving emotional care and everything along those lines. Would you agree with that statement based on the care that you've received from your nurses?
Okay, again, because I've seen mostly female nurses, I do think that they provided emotional care, but that doesn't necessarily mean that because they're a woman, they have emotional care. There has been women who were not very warm, and that's not to say that the male nurses I did see were not warm or emotionally sensitive. I think they were. But I think as a society, we would perceive women to be more emotionally sensitive. But no, I don't think that's true for all nurses.
Very good. And so I think I can guess your answer from how you've been answering these questions. Do you have a preference as far as your nurse in the future?
Again, sensitivity matters. If I'm just going in for just a general issue, no, I don't matter. I don't care, excuse me. But if I'm going, again, to my gynecologist, I want a female nurse present.
Right. Yeah, and that totally makes sense. Well, thank you so much for your insight. This has been wonderful, and thank you again for taking the time to do this.
You're welcome.